You wake up in the morning, you haven't even fully opened your eyes yet, and you already feel it. Your tongue stuck to the roof of your mouth, your lips dry and cracked, a strange dryness that doesn't go away even after your first glass of water. You get up, walk to the kitchen, drink, and think, it's just age. Everybody feels this way. And you go on with your day. But what if I told you that this simple feeling, this dry mouth that you've come to accept as normal, might actually be your body trying to warn you about something much more serious? About your heart? About your blood sugar? About your kidneys? About a problem with your sleep that you don't even know you have? Today, I'm going to show you the 6 most important causes of dry mouth in people over 60 years old, from the simplest to the most serious, and what you can do about each one of them. Stay with me until the end, because cause number 4 is the one that surprises people the most, and it may be happening to you right now without anyone ever having warned you about it. But before we get started, let me introduce myself. I'm Dr. Santiago García, a physician with over 20 years of experience, specialized in the care of people over 60 years old. Throughout my career, I've seen more than 10,000 older patients, and I learned something that medical school never teaches. The human body talks. It sends messages, small, quiet messages that we tend to ignore. And waking up with a dry mouth every morning is one of those messages. Before we continue, I would really love to know, what city are you watching me from right now? Write it down in the comments. It can be a small town, a big city, anywhere across the country. It makes me really happy to know where each person watching this is coming from. This channel was created for you, and knowing where you are helps me keep bringing content that truly makes sense for your life. Before we talk about the causes, let me explain something that is going to change the way you think about your own mouth. Most people think saliva is simply water, just that liquid sitting in your mouth. But that's not even close to the truth. Think of saliva as a security guard working around the clock inside your mouth. It does many things at the same time. It cleans your teeth of bacteria constantly, like a janitor who never stops working. It starts digestion while you chew, preparing your food before it even reaches your stomach. It protects your gums from inflammation and infection, and it lubricates your throat, making swallowing safe and easy. When that guard disappears, everything becomes vulnerable. Your teeth start getting more cavities, your gums get inflamed. And here is the most serious point: swallowing becomes difficult. And for a person over 70 years old, difficulty swallowing isn't just an inconvenience. It's a real risk of food going into the lungs instead of the stomach. Doctors call this aspiration pneumonia, and it is one of the leading causes of hospitalization and death in elderly people. So, when your saliva decreases, the consequences go far beyond just having a dry mouth. And here is what changes after 60. The glands that produce saliva age right along with the rest of your body. Production is already naturally lower. Anything that interferes with that already reduced production has a much bigger impact than it would in a 35-year-old. According to the World Health Organization, dry mouth affects between 20 and 30% of the general population. But in people over 65 years old, that number jumps to over 40%. And in older adults who take 5 or more medications per day, which is the reality for nearly half of all seniors in this country, that number can reach 60%. 3 out of every 5 older adults who take multiple medications have dry mouth, and most of them think it's just a normal part of aging. It is not. Let's understand what is actually causing this. The first cause is dehydration. But not the kind of dehydration you're thinking of. When most people hear the word dehydration, they picture someone who's been out in the sun for hours, dizzy, with dry lips and dark urine. That's severe dehydration. You'd recognize it. But there's another kind of dehydration. A mild, silent, chronic dehydration that a person carries around without even realizing it. Because one of the things that changes the most with aging is exactly the ability to feel thirst. Let me explain it with a simple analogy. Imagine there's a thirst alarm in your brain. When your body starts needing water, that alarm goes off. You feel thirsty, you drink, and the problem gets solved. In a young person, that alarm is very sensitive. It goes off early before the problem gets serious. In a person over 60, that alarm gradually loses its sensitivity over time. Your body may desperately need water, and the alarm just doesn't go off. You simply don't feel thirsty. A young person starts feeling thirsty after losing about 1% of their body's water. A 70-year-old can lose 3 or 4% and feel nothing at all. The result is that many older adults live in a state of mild, permanent dehydration without knowing it, and waking up with a dry mouth is one of the few visible signs of that invisible condition. A study with over 800 older adults showed that 65% of them had some degree of chronic dehydration, and most of them didn't feel thirsty at all. Let me tell you about one of my patients, Mr. Robert, 74 years old, retired from Denver, Colorado. He came to my office complaining of dry mouth every single day, always cracked lips, and difficulty swallowing his morning toast. When I asked him how many glasses of water he drank each day, he scratched his head and said, "Maybe 2, doctor, perhaps 3. I just don't feel like drinking, you know?" But he was drinking 4 cups of coffee a day, soda at lunch, juice from a carton in the afternoon. I explained to him that coffee and soda don't hydrate the body the same way plain water does. In fact, too much coffee can actually dehydrate you a little more. Together, we put together a very simple plan. 1 glass of water first thing in the morning, before anything else touches his lips. 1 glass before breakfast, 1 before lunch, 1 before dinner, and 1 before bed. Just that. In 2 weeks, his dry mouth had improved by more than 70%. Don't wait until you feel thirsty to drink water. In older adults, by the time thirst arrives, it's already too late. Your body is already dehydrated. Use reminders on your phone, or an even simpler strategy. Leave a water bottle in the spot in your home where you spend the most time. In the living room, near your favorite chair. On the kitchen counter. If it's right in front of you, it will remind you to drink. The goal is between 1.5 to 2 liters of water a day. You don't have to drink it all at once. Take it slowly, little by little, throughout the day. In just a little while, I'll tell you about cause number 4. The one that doctors investigate the least and the one that most affects people who take several medications at the same time. But first, I need to tell you about a cause that surprises absolutely everyone when they find out. The second cause is sleep apnea. And when I bring this up in my office, the person almost always says, "I don't have that, doctor. I don't snore." So let me tell you how sleep apnea actually works. During the night, while you're sleeping, the muscles in your throat relax. In some people, they relax too much and the airway becomes narrow or closes completely for a few seconds. The body detects that it isn't getting enough oxygen and sends an emergency signal for you to open your mouth and breathe. You open your mouth, you breathe, and you don't even notice because you're still asleep. But for hours, your mouth has been open. And when your mouth is open for hours, the air passes over your tongue, over your cheeks, over your lips, and dries everything out completely. You wake up feeling like you slept with your mouth inside a running hairdryer. A study with over 1,000 adults who complained of waking up with dry mouth found a striking fact. Among people with no nighttime breathing problems, only 3% had dry mouth when they woke up. Among people with severe sleep apnea, that number jumped to over 31%, 10 times more frequent. And the worst part, dry mouth was often the only sign the person noticed. Because sleep apnea happens while you're sleeping. You don't feel it when it's happening. After age 60, the muscles in your throat naturally lose strength, just like every other muscle in your body. That's why sleep apnea is much more common in older adults. More than 50% of people over 65 have some degree of sleep apnea, and most of them have never been diagnosed. I remember Mr. George, 68 years old, a retired government worker from Phoenix, Arizona. He came to see me because of dry mouth. He told me he didn't snore, his wife confirmed it. But when I asked the right questions, the story changed completely. Do you wake up feeling tired even after sleeping 8 hours? Yes, every single morning. Do you have a headache right when you get up? I always figured it was my blood pressure. Do you get up in the middle of the night to use the bathroom several times? About 3 times every night, doctor. Those 3 signs together are a huge red flag for sleep apnea. I sent him for a sleep study, which is a test that monitors your sleep throughout the entire night. The results showed more than 22 episodes of stopped breathing per hour. With the right treatment, his dry mouth disappeared in less than 3 weeks. And at his follow-up visit, he told me, "Doctor, I didn't know I had never actually slept before. If you wake up with a dry mouth and also feel tired for no clear reason, have headaches first thing in the morning, get up several times at night to use the bathroom, or someone has told you that you stop breathing while you sleep, Talk to your doctor about getting tested for sleep apnea. I'm going to pause here for just a moment because I need to ask you a favor. If you've made it this far in this video, it's because this content is being useful to you. And I want to keep bringing this kind of information every single week. Serious information based on science, but explained in a way that anyone can understand. To do that, I need your help. Hit the like button right now. That simple gesture tells the YouTube system that this video deserves to be shown to more people, to more grandparents, to more parents, to more people who are going through exactly what you're going through and haven't found the answer yet. And subscribe to the channel if you haven't done that already. Every week there's a new video made specifically for people who are 60 years old and older. Now let's keep going, because cause number 3 is already very important, but number 4 is truly going to surprise you. The third cause is diabetes. And here I need to be very direct with you because this is one of the most dangerous diseases precisely because it hides for such a long time. Type 2 diabetes is very common in older adults. According to data from the World Health Organization, 1 in every 3 adults over 65 years old has diabetes. And nearly half of those people don't know they have it. Why? Because in the early years, the symptoms are subtle, easy to ignore, easy to blame on age. But the body sends messages, and one of those messages is dry mouth. Let me explain the mechanism in simple terms. When blood sugar is high, the kidneys try to solve the problem by eliminating that excess sugar through urine. But to eliminate sugar, the kidneys need a lot of water. And where does that water come from? From the body itself. The result is that the body becomes dehydrated from the inside, even if you're drinking water. The salivary glands receive less water to work with, produce less saliva, and the mouth dries out. It's like having a faucet in your home and someone has shut off the main water line at the street. No matter how much you open the faucet, the water simply doesn't come. Miss Dorothy, 71 years old, a retired seamstress from Nashville, Tennessee. She came to my office with intense dry mouth every morning and a thirst she described like this. "Doctor, I drink water like I've been out in the sun for hours, and it just doesn't seem to help." And a tiredness she blamed on getting older. "It's normal, right, doctor? At over 70, that's just the way it is." I ordered routine blood work. Her fasting blood sugar was 198. Normal is below 100. She had been living with diabetes for at least 2 years without knowing it. Her body had been sending messages for 2 years and no one had been listening. After starting treatment and getting her blood sugar under control, the dry mouth gradually got better. 3 months later, she called me and said, "Doctor, I woke up this morning and my mouth felt normal. I had forgotten what that felt like." If you wake up with dry mouth and also feel a thirst that won't go away during the day, wake up in the middle of the night to use the bathroom frequently, or have a tiredness that no amount of rest fixes, ask your doctor for 2 simple blood tests, a fasting blood glucose and a hemoglobin A1C. Both can reveal a diabetes that has been going unnoticed. We've arrived at cause number 4, and as I promised, this is the one that surprises people the most. Let me ask you a question. How many medications do you take each day? 1, 2, 5, more? The United States Department of Health has already identified more than 400 medications that have dry mouth as a side effect. 400 medications. And many of them are exactly the ones most commonly used by older adults. Blood pressure medications, especially diuretics, which are the medications that remove water from the body through urine. They were created precisely to do that, to pull water out of the body. When they do that, the salivary glands also end up with less water to produce saliva. Antidepressants, which act on the nervous system in a way that reduces saliva production as a side effect. Antihistamines, those allergy medications that most people take without a prescription. Medications for overactive bladder, very commonly used by women over 60. Sleep aids and anti-anxiety medications. And medications for Parkinson's disease. Each one of these medications on its own might cause mild dry mouth, something tolerable that you might not even notice. But here is the problem specific to older adults. They rarely take just one medication. When a person takes 3, 4, 5 medications at the same time, each one with that potential, the effects add up. The mouth stays permanently dry, the lips crack, swallowing becomes difficult, and the person thinks it's just part of getting older. It is not part of getting older. It is the accumulated effect of medications that have never been reviewed together. Let me tell you about a patient I will never forget. Miss Margaret, 76 years old, a homemaker from Chicago, Illinois. She came to see me with a complaint she called a silly little thing. "Doctor, my mouth is always dry. It hurts when I eat bread," and I figured I was just imagining things. When I asked her to show me her medications, she opened up a bag. I counted 7 different pills, one for high blood pressure, one diuretic, one antidepressant, one for chronic allergies, one for joint pain, one for sleep, and one for her bladder. All of them with the potential to cause dry mouth. All of them together were turning her mouth into a desert. I sat down with her primary care physician. We did a complete review of her medications. 2 were switched to alternatives that cause less dryness. 2 others had their timing adjusted. And within 6 weeks, the situation had improved tremendously. She didn't stop taking any important medication. She didn't put her health at risk. She simply had someone who looked at the whole list all at once. At your next appointment, bring all of your medications in a small bag. Pills, vitamins, herbal supplements, everything. And ask your doctor this question directly. "Doctor, could any of these be causing my dry mouth? Is there an alternative?" That one simple question can change your quality of life. And in just a moment, I'll tell you about cause number 5, which mainly affects women and takes an average of 3 to 5 years to be correctly diagnosed. Many women spend years suffering without knowing what is happening to their own body. The 5th cause is Sjögren's syndrome. That's a hard name, I know. But what it does is easy to understand. In your body, there are glands responsible for producing moisture. The salivary glands, which produce saliva, and the tear glands, which produce the tears that keep your eyes moist. In Sjögren's syndrome, the immune system makes a serious mistake. Instead of attacking outside invaders, it starts attacking those very same glands. It's like the security guard at your house mistaking the neighbors for intruders. The result is a mouth that burns, that hurts, where even swallowing water becomes difficult, and eyes that itch, that sting, and that turn red frequently, even without any infection. About 90% of patients with Sjögren's are women, and the diagnosis is most common in the 50 to 65 age range during the postmenopausal period. The most serious problem is time. On average, a woman with Sjögren's waits 3 to 5 years between the start of her symptoms and the correct diagnosis. Why? Because the dry mouth gets labeled as dehydration. The dry eyes become tiredness. The fatigue becomes stress from getting older, and the disease keeps progressing while no one identifies it. Miss Barbara, 63 years old, a retired teacher from Portland, Oregon. She was using eye drops all the time, drinking water constantly, and her mouth never got better. She told me during one appointment, "Doctor, I drink 2 liters of water a day, and it feels like my body absorbs nothing. My mouth is dry again immediately." When we ran the specific blood tests, the diagnosis was Sjögren's. I referred her to a rheumatologist, she started the right treatment, and 2 years later she called me to say, "Doctor, I feel like myself again." If you are a woman, have dry mouth that doesn't get better with hydration, and also frequently feel dry eyes, along with fatigue and joint pain, ask your doctor to investigate this condition. Early diagnosis makes all the difference. The 6th cause is chronic kidney disease. And this is the one that worries people the most when I explain it, because it is far too silent. Your kidneys are your body's filters. They work 24 hours a day cleaning your blood, removing the substances your body doesn't need, and eliminating them through urine. When the kidneys start losing that ability, the substances that should have been removed stay in the blood. The body tries to compensate by urinating more, it loses water. And the salivary glands, with less water available, produce less saliva. But there is one detail that sets this cause apart from the others. Many patients with kidney problems describe a metallic taste in their mouth, along with the dryness, like having a coin sitting under their tongue. This happens because the substances the kidneys should have filtered end up reaching the saliva. Mr. William, 70 years old, a retired farmer from rural Kansas. He came to see me because his wife was worried. "Doctor, he wakes up every day with a dry mouth and he's been complaining about a metallic, rusty taste in his mouth for as long as I can remember." His legs were mildly swollen. His blood pressure was high despite his medications. I ordered kidney function tests. His kidneys were functioning at just over 50% of their capacity, and the creatinine test, which is the one most doctors order, was still within the normal range. What revealed the problem was the glomerular filtration rate, a more precise calculation. With proper follow-up care, we were able to slow the progression of the disease, and his quality of life improved significantly. If you have frequent dry mouth along with swelling in your legs and feet, foamy urine, high blood pressure that's hard to control, or that metallic taste in your mouth, it is essential to investigate kidney function. Ask your doctor for a creatinine test and a glomerular filtration rate. They are two simple blood tests. Now I want to give you a practical plan, simple and concrete, so that you leave this video knowing exactly what to do. Step 1. Observe for 1 week. Does dry mouth happen every day? How intense is it? Do you have other symptoms? Thirst that won't quit? Tiredness for no reason? Dry eyes? Waking up several times during the night? A strange taste in your mouth? Write it all down on paper. That record is going to be very valuable at your next doctor's appointment. Step 2. Review how much water you drink. Don't wait until you feel thirsty. In older adults, thirst is a late signal. By the time it arrives, you're already dehydrated. Use the visible glass strategy. Leave glasses of water in the spots around your home where you spend the most time. Drink before you feel the urge. Step 3. Bring your medications to your doctor. In a small bag, all of them. Pills, vitamins, herbal teas, supplements, everything. And ask directly, "Doctor, could any of these be causing my dry mouth?" Step 4. Ask for the right tests. Fasting blood glucose and hemoglobin A1C to check for diabetes, creatinine and glomerular filtration rate to evaluate your kidneys. If you are a woman with dry eyes and dry mouth, ask about specific antibody tests for Sjögren's. Step 5. Investigate your sleep. If you wake up tired, have headaches in the morning, or get up several times during the night to use the bathroom, talk to your doctor about a sleep study. Step 6. Pay more attention to your oral health. Saliva protects your teeth and gums. When it's gone, the risk of cavities and infection goes up significantly. Brush your teeth at least twice a day, use dental floss, and visit your dentist regularly. This is even more important when dry mouth is a problem. Before I finish, I want to tell you something that I consider the most important thing of all. The human body is extraordinary. It works without stopping, day and night, to keep us standing, functioning, alive. And when something isn't right, it starts sending messages. Small, quiet messages that we learn to ignore over time. The dry mouth you woke up with every day and thought was normal may be your body trying to tell you a story about your kidneys, about your blood sugar, about your sleep, about your medications, about a condition that doesn't have a name yet, but that has treatment, has a solution, and that, when discovered early, changes everything. The problem isn't that the body doesn't speak. The problem is that nobody taught us how to listen. Today, you learned to listen a little better, and that is already a huge step. Now I'm asking you one thing. Do you know someone who wakes up with dry mouth every day and thinks it's just part of getting older? A mother, a grandmother, a neighbor, a friend? Someone who always mentions it but has never looked into it? Send them this video right now. Through a text message, in a family group chat, in a direct message. The information you are sending them might be exactly what that person needs to finally seek help. And to seek help before the problem gets worse. Sometimes one video changes a life. In the next video, I'm going to talk about the knee that hurts when you get up from a chair, why it happens after 60, what the warning signs are that you can't ignore, and what you can do at home to relieve that pain safely. You're going to be surprised by one of the causes because it has nothing at all to do with the knee itself. Subscribe to the channel and hit the notification bell so you don't miss it. I'm Dr. Santiago García. Pay attention to the signals your body is sending you. They are trying to help you. Wishing you good health, peace, and a wonderful quality of life. See you in the next video.